So today I'd like to talk to you about headaches. Next to back pain, headaches are the #1 reason that patients go see their doctors. Fortunately, for most headache sufferers, most of these things can be treated conservatively in a short period of time and require no long-term medication. There are many different kinds or types of headaches, or different categories. So I'm just going to go over some of the more common ones with you and how we approach the treatment of these. First, let's talk about the muscle tension headache. This can occur in the front area of the head, the temporal area, the back of the head, usually associated with neck stiffness, tightness, particularly the upper trapezius muscle. It's interesting about the upper trapezius muscle, it actually gets a nerve supply from cranial nerve 11. And what that means is we can actually think this muscle tight. Yeah, we can worry. Do any of us worry? Yeah, we worry about finances, we worry about our spouse, we worry about our job, we worry about our children. So we can actually, the more negative thoughts we put between our ears, the tighter these muscles get. Our #2 type of headache I'm going to talk about is migraines. I have patients tell me all the time, oh, I had a migraine yesterday. And most people, when they say a migraine, just means it's a really bad headache. Actually, migraine headaches are a type of vascular headache, and it's usually, it throbs or it pounds, that it's almost it's very cyclic, and it goes with your heartbeat, because what happens is all your blood vessels in your head are engorged, and they're just, all the blood is stuck in your head, literally, and it can't get out. And this is causing a lot of pain. These are usually one-sided. Unilateral means more one side or the other, off around the temple frontal eye area. Again, many times we see involvement with the upper cervical spine and relief. The upper cervical also has the vertebral artery, the blood supply that goes up in between little openings in on the side of the bones. So again, this area can be effectively treats the migraine. Other very common reasons for migraines is food allergies. We provide our patients with migraines, headaches, a food list. Some of the different things that are very common are peanuts, chocolate, certain cheeses, certain alcohol, MSG, lots of different things. So usually the person can isolate the offending factor, because usually it's usually within 6 or 12 hours of eating the offending food that will produce the migraine effect. One of the great tools for treating vascular headaches like migraines is acupuncture, particularly electrical acupuncture, the application of acupuncture with a microcurrent, with a wet probe versus a needle. And even in the acute stage, in the vast majority of these patients, we're able to bring people out of an acute migraine just in a matter of seconds. Again, from a therapeutic standpoint, if we remove the offending foods, take care of any problem in the cervical spine, and with acupuncture, the vast majority of migraine sufferers are resolved and in a number of weeks. Again, probably 90% success rate with this methodology. Some patients need some supplementation, B6, magnesium, feverfew, or some of the nutrients that we use or herbs that we use. Migraines are more common in females. We're going to talk about another type of headache, cluster headaches, which is more prevalent in males. Next, it's also a type of vascular headache, and cluster headaches occur kind of like the name indicates, in clusters. So someone may have multiple headaches in a day, multiple days in a row going on for 2 or 3 weeks, and then have no headaches at all for months or a year, and that recur. Similar methodology with the treatment is acupuncture and chiropractic. Again, very effective tool. Another very common type of headache is sinus headaches. Sinus headaches usually occur around the eyes. The sinuses are above your eyebrows or below. This is usually a pressure type feeling in the head, and usually associated with nasal congestion or ear congestion. Now, it's interesting, in acupuncture, the sinus or the lung is energetically entwined with the large intestine. So your nose is actually the beginning of the pathway to the lung. And we find many patients who have chronic sinusitis have a problem with a lack of hydrochloric acid secretion. So by getting the stomach or the gut fixed, by supplementing beta hydrochloride, Zypan, other nutrients that will help the stomach secrete better hydrochloric acid, that resolves the problem. You know, sinusitis, even the medical literature indicates that antibiotics are really not effective for chronic sinusitis. There are other nutrients that we use for that as well. And again, the other reason for chronic sinus problems could be excess phlegm, secondary to reactions to foods, particularly dairy products, casein and milk, #1 food allergen, gluten and wheat, bread, grains, #2 food allergen. So those are the different areas that we look at. Again, sinus acupuncture is a very, again, good tool for that in the acute care, that we can actually treat specific points in the lung and large intestine meridian, usually open up the sinus and get some drainage right away. Another type of headache which can occur is a blood pressure headache, and this is usually a headache you wake up in the morning. So if you wake up with a headache in the morning and you didn't earn it the night before by having too much fun, then you might be a little bit concerned about why that's happening. And again, if you have no association with neck pain or stiffness, because you could potentially sleep wrong and have an occipital headache or some area headache because your neck was kinked up. But if your neck doesn't bother you and you're feeling a lot of pressure headache, you know, those should be taken seriously, and it could be an indication of your blood pressure being elevated. So again, all these things that we've talked about, the type of headaches, all respond beautifully to a conservative approach, and are usually, even in a chronic situation, able in just a few short weeks get a resolution. So again, I encourage you, if you're hearing this and you have headaches and you have not found a good solution for it, come in and get a consultation, because again, we're looking at several different areas. Are we looking at an allergen? Are we looking at a mechanical problem? Are we looking at a physiological functional problem from digestion? Are we looking at food allergen or a deficiency? Again, different nutrients can be added to help the immune system and help heal this without taking an antibiotic.